now we look forward towards Dr. Susan MacDonald, and she is one of the senior advisor and patron of WOW. And she is inspiring because of her energy and zeal that about the charity work she is doing in sub-Saharan Africa. She is the president of ICOPS, a non-profit organization over there. And also she is an associate clinical professor of Tufts School of Medicine in USA. And we look forward to her talk about charity overseas. And over to you, Dr. Susan.
Thank you very much. These talks have been extraordinary. I have to say, listening to each of them, there's so many pearls that we need to grab onto. And I think one of the most important ones that I'm going to add is stay focused. Society is complicated. There's lots of philosophical discussions we can be having, but what your job is to focus on you and get the best opportunities for you and develop your career. It may be entertaining to sit and have a discussion about the philosophy and defend WOW or defend women, but the real goal is not to get distracted. Stay focused on your career. My talk is about global ophthalmology, and we've already heard how many different ways that you can participate. And I think you can actually see this as a stepping stone on a career that I have done a pivot in my career. I was a clinical ophthalmologist and did clinical research and did a huge amount of teaching. And then I had an opportunity to lead a nonprofit in sub-Saharan Africa. Now, what allowed me to do that was that I had a really strong background in education. I have a fellowship in medical education, and I taught day in and day out with my residents. So I think as you see your career building, know that there will be opportunities in your life that may be presented to you, and you can pivot, but you also, as you're building your career, you're building your skill sets. So these are all the ways that you can work and do work internationally. You can start participating, and if you want to, ICOR would love to have WOW give members have an opportunity to lecture in our lecture series in Tanzania. We also have mentorships, visiting professorships, and then there's opportunities to volunteer. And then where I'm at is I'm actually working for an NGO now, and I actually am doing consulting for industry on how to bring products to areas that have a lower economic level, and really pushing those industries to not over-engineer their devices. So let me tell you about ICOR. It's 6 years old, and we started it as a nonprofit about 2 years before the pandemic. And we're in Africa, we're in Tanzania. And so when I started, I'm just going to tell you how this evolved. I had an opportunity where a donor, a colleague of mine, wanted to make a change. And so I proposed this, but I had to do a lot of research, found out Tanzania's population rate, their blindness rate. And then one of the interesting things I found is the clustering of the ophthalmologists in Dar es Salaam, in Kilimanjaro, and in Mwanza. And so I also found out that a lot of people weren't operating, that they had a license and a degree to operate, but they weren't operating. And the other piece we found out is the outcomes of the surgery were only 59% of patients that had cataract surgery actually had best corrected vision that was better than their preoperative work, which is really terrifying. So I kept asking and trying to figure out, and I think this is why we're being so successful, is I really led with being a woman. I wanted to know answers. I didn't make assumptions. And I interviewed so many people. I did my homework and did research. And I found my girlfriends who happen to be, some are ophthalmologists and some are nurse practitioners or circulating nurses. And we had been going on these outreaches and doing work, but we were convinced that having a team from the United States come in and do a week's worth of work was not the sustainable solution. So we sat around, we brainstormed, and then we kept communicating, and we found out that the surgical training was minimal, that there were redistribution challenges, and that the residents were either not practicing ophthalmology at all, and they were going into another general medical field, or they were leaving medicine. So those are big challenges to keep people involved. We saw ourselves as we're partners in our relationship, and so we found partners to work with. We did not come in with this egocentric feeling of that we were going to make the changes. We were asking for what other people thought was the problem, and then we set out to work together to form solutions. So we boiled it down to 3 options: equipment, education, and mentorship. And we began to work on that. And we started by teaching nurses, and then having the nurses, we gave them an opportunity to teach. We were and I think any senior ophthalmologist or mid-career ophthalmologist needs to pay attention to this. It's your responsibility to let go of these things you're comfortable in. Like lecturing about something can be very comfortable and it's your space. But if you can move forward and pull another woman or a man into that position, that's you're mentoring them, making sure they're capable of doing it. And then you're actually promoting their career. The next thing we really did talk about mentorship and talk about opportunities. And what we've done as far as equipment goes is I've done fundraising beyond what I ever thought I was capable of. There was one time in my life I was so afraid to talk about money because it made me uncomfortable. Now I do a lot of fundraising, and I've found my way and I've found my voice in how to do that. So we bring equipment in, they're refurbished Zeiss ophthalmoscopes, and we have really focused to provide the tools. And then the second piece is we've developed a wet lab, and we've developed an outreach model that we're not doing 500, 700 cases. We do an outreach model where we do 200 cases. And what we're doing in that time period is that we're teaching, and we're teaching every station along the way. We're teaching biometry, we're teaching the pre-op exam, and we have residents circulating with us. And the residents know that it is just as important to understand the biometry as it is to perform the surgery. And the mentorship has been something incredible. And what we're doing is we're actually lifting up the senior ophthalmologists in Tanzania, and we're connecting them to junior ophthalmologists, and we're supporting this relationship of them traveling to these more remote areas to work with the junior ophthalmologists. And like my sisters before me spoke on this, is partnership and collaboration is what it's all about. And women, I will tell you this, networking, you do it naturally. We love to bond with each other. So I get a little social anxiety. And so I just say to myself, you know what, you go out there and you just connect with people and you ask questions. And when I get nervous, what I'll say, I'll just ask them a question about themselves. And then all I have to do is listen. And I'm learning a lot. And then when it's my turn, I will tell them something about me. But when you're networking, you don't have to have your elevator pitch and like talk all about you. Just be you, natural you, be you, curious you. So to date, we've trained 12 surgeons, and which is a huge, and we have a memorandum of understanding with the government. We're working with Muhimbili. We have a memorandum of understanding with Muhimbili. We have a memorandum of understanding with Tilganga. And I am very proud of the work we've done to date. And our surgeons, these surgeries performed are not the ones we're going over and doing. These are our surgeons have gone from maybe doing 20 cases a year to each of them are doing over 100 cases a year now. And I am having the time of my life. And, you know, I'm in a position of power where I can now say to people, you know what, we need to make sure that women are getting equal access to care. And having a seat at that table is allowing me to advocate for females. And we have actually we have a little routine that we do for if there's a woman in the queue for being evaluated for cataract surgery, we really make sure that we don't lose her. And there's very many different ways that that woman can get lost. And we have this little mnemonic we use to make sure that everybody on the team is responsible to making sure every opportunity available to support that woman to get her surgery is offered to her. And so finally, you know, this is our first outreach we had. And I love this saying, plant trees under whose shade you do not expect to sit. This Alan Crandall and I he came on my first outreach as ICOR, and this was our design. And you can see there's a lot of US people there. And this was the design of what we were doing. Now, this is our last outreach that we have done. And you can see that it is amazing to me that this is being done, and there was only one white person in the room, and that was me, and I was sitting on a chair doing nothing. This is just extraordinary. So you know, I sort of, how did I find this opportunity, and how did I let my heart speak? And I really, when I fundraise, I talk about this of I just was with my colleagues, and I realized my colleagues did not have, that they had a skill, but they didn't have the equipment to actually use it. And so how painful it must have been every time they saw a patient to not be able to do the surgery. And that's how I felt. And instead of sounding like a man, I just spoke as through my heart. And I really think that is one of the reasons why people listen to us and really are supporting us. So thank you.